Hello, everyone, and welcome to Meet the Experts. I'm Dori Soukup, and with me today is my special guest and expert, Dr. Lonny Green. I am so excited to have him here with us today because we are exploring a topic we have not discussed prior to this moment, and that is addressing the millennials and seeing exactly what are they looking for when they visit the med spa and what treatments are they most interested in. You are in for a treat today, so stay tuned and I'll see you in just a moment. Hello, everyone, and welcome back. I am here with Dr. Lonny Green. He is the founder and CEO of Rejuvenate MD in Richmond, Virginia, and he is here today to share his expertise with all of you. And as I mentioned, we are discussing the millennials and what are they looking for when they go to a med spa. I'm so happy to have you here. Welcome.
Thank you for having me. I love being here.
My pleasure. Yeah. So let's start first by telling them a little bit about yourself. And how did you get to start Rejuvenate MD?
Okay, well, it's interesting. I consider myself, I am now an aesthetic physician.
Yes.
But in a previous life, I was a board certified urologist treating exclusively women.
Yes.
I've done that all my surgical career, but I've also had an interest in alternative medicine, complementary medicine, and as I got older, my patients got older, and most of my women were going through menopause.
Mm-hmm.
They knew I was interested in alternative approaches and that I believed in bioidentical hormone replacement.
Mm-hmm.
I tried doing it in the practice. My partners were not on board, and ultimately it led me to start something different. And it was born out of a vision of not just being bioidentical hormones, it was more of a total person.
Mm-hmm.
And so we grew into medical weight loss, and then we grew into aesthetics. And once I learned aesthetics and what I could do with my hands
Mm-hmm.
as a surgeon, I was no going back. It became a new life, and that's all I do now. It's a passion of mine. I love it.
It's very nice. You focus on the total transformation of people when they come to see you, and that's truly what you want to do moving forward.
Yeah, I just love it in all aspects. I think physically and emotionally, spiritually and psychologically,
Yeah.
it's just what turns me on.
I bet that was a big decision, though, to leave everything that you have known for years and all of a sudden starting something totally different, totally unique to you. And loving it.
Yeah, no, I'm not going to lie. It was a bit scary,
Yeah.
but I think the biggest growth in life comes when you face fears and just go for it.
It's very true.
Yeah.
And it seems like many doctors actually like to have differentiation in their careers. After you've done something for so many years, it's always nice to start something new and exciting and something that you're fulfilling demand for, because there is huge demand for what you're doing right now.
Yeah, I would love to take credit and say I planned this, but I didn't, Dori. This just happened to me.
Yes.
But a lot of my life has happened to me, and so I'm very, very fortunate. I've been very fortunate and continue to be fortunate. I'm very grateful for that.
Yeah, to have a second career in medicine, I think that's outstanding.
Yeah,
Very
one which I
nice.
love.
Yeah.
Yeah.
Now, the other passion of yours is that you chose to help millennials more than anybody else at this point. So let's talk a little bit about what is it about the millennials that you really like to help and work with?
You know the saying, I didn't choose the gangster life chose me. It's not that I chose the millennials, or I see a broad range of patients, but we have our population at Rejuvenate has shifted to a very large percentage of millennial populations. Mm-hmm. And I think that humans are humans, but there's specific needs they have, specific ways they approach things. And obviously I'm not one, but I think that the combination of understanding what they need, what they want, what they're looking for, and my perspective is a really cool groove that I've just really enjoyed.
Yeah, well, that's why you decided to write your book about what their needs are.
Yeah, it's exactly why, because I'm really big on planning. I don't want to be the place where people come and get Botox a couple of times a year and gone. It's just, I see too much of that in the industry, and it's more like, okay, where do you want to be in 5, 10, 15 years? Let's look at a roadmap. Let's give you some information. I mean, it's information at the end of the day. Yeah.
That's true. So what is your book going to be about exactly?
So the book is going to be a guide for millennials who are just wondering, noticing, their face is changing
Yes.
because as we get older, our face starts to change.
Yes.
And
Don't we know?
yeah, we know that. We know that. And if you don't know, you sort of wonder, is it normal? Is it something I'm doing? What's it going to look like? Am I going to look like my mother? Or am I going to look like my father? And so at the end of the day, I just felt like providing information in a way that relates to, I think, what they're going through is valuable. And I thought long and hard about it, because clearly I'm not a millennial, but I think the value added is that I have the perspective of someone who unfortunately has been through the aging process. And so, to put that perspective on it, it's hard to do that if you haven't been there and then say, well, here's the things I've learned. So that's what I hope my little addition can be to the knowledge base.
That's very nice. Well, you said something that kind of struck a chord with me, because I did look like my mother. And when the millennials are looking at their family members, they are having those thoughts. And if their parents don't look as good as they would want to look, that's why I think we're seeing a big movement of millennials coming and actually doing some preventative care and some treatments addressing certain concerns, because they don't want to look like their parents, because their parents probably did not do all the treatments that you are offering right now.
Yes, you're exactly right. I see a wide range. I see some folks where their parents have and they want to continue. I see folks where they haven't, and I love what really is crazy is like they'll sometimes bring their parents in, and I've also had some parents bring their kids in. So it's all good, but it fascinates me that some of the things like you just mentioned, you had thought about that.
Yeah.
I think a lot of people think that, but they don't always verbalize it.
Yeah.
And once you start talking about it,
because I look like my mom. I mean, all the way down to my hands.
Yeah.
It's like we looked so similar.
Yeah, she's a beautiful woman, no doubt.
Well, no, thank you. You're so kind. She had the most beautiful skin and everything. But she did have some concerns that I'm sure we're going to address with some of the body parts. And those are some of the things that when you look at your parents, you're like, oh my gosh, am I going to look like this? And what can I do to really address it?
Yeah.
And those are some of the things that I want to explore with you as to what treatments are available today for millennials, so they can look their very best at their parents' ages, right? Isn't that the whole purpose?
Absolutely. And I will just tell you that a lot of the things we're going to talk about aren't just for millennials. As a matter of fact,
true.
I would say all of them are not just for millennials.
Yes.
But I did want to come at this knowledge, this information from a standpoint that I thought would be more accessible and understandable for that generation. That is,
and it's actually a topic that we need to address, because as I mentioned in my intro, we've never talked about that target market before and what are some of the solutions that are available for them, because they're a big group. Actually, they represent the biggest group in the population now, more than the baby boomers, actually. So there are so many of them, and they all need help, and they're looking for physicians like yourself to learn the solutions and what is available to really help them. So let's start by discussing some of the options. So when someone comes to you in that age group, or it could be in other ages, like you said, what are some of the most problematic things that they see? Like you mentioned, oh, why is my face changing? So let's start from that, and then maybe go into different modalities that they can have.
Sure. The first thing I do is really get to know the person a little bit. I mean, it's really important. Our consults are way more time than most. And so I have to know who they are, and they know me a little bit. So I just find out a little bit about them. That's really important. Otherwise, this job is no fun.
Yeah.
And then...
Well, you're a people person. You just like to really get to know the person, like you're saying.
I do enjoy that part of my job. I've been very blessed. So then the next thing I do is we just talk a little bit about beauty, because age and beauty are interrelated, and a lot of people don't understand beauty. In fact, I would go to say that virtually no one who I've spoken to in my chair has really understood from my perspective, and as I understood it, because the issue I had with becoming an aesthetic physician was I really have a very scientific mind. I really want to know things in a very calculated way. I want to be able to study it. And there actually is a very much of a mathematical background to beauty, and there's a science behind beauty.
Oh,
Absolutely.
I can't wait to hear about it.
100%. Yeah, beauty is not by chance.
Okay.
And if you look at the beautiful faces across the cultures in the world, we all agree on a lot of things that people think beauty is in the eye of the beholder, but it is not. It's in the Phi of the beholder. So that there's this thing called Phi, and it is a ratio found in nature that is incredibly pleasing to our brain.
Okay.
Because you don't know it, but in your brain you have a beauty computer. All right. So you're walking down the street, you got Tara calling you, you got a million things going on, and out of the corner of your eye, there's a beautiful woman or a really handsome dude. Does that register?
I prefer the handsome dude.
All right. But well, women like looking at women too, but it registers, right?
Yes.
It registers, yeah. And in fact, there are studies published in the plastic surgery journals, okay? And they're 4-month-old infants, and they have 2 people looking over the infant, and one person has a classically beautiful face, the other person has not such a beautiful face. And in a short time, the infant is almost only looking at the beautiful face.
Wow.
So there's no cultural
That's
bias.
amazing.
It is amazing. To me, a light bulb went off. I mean, so there is a mathematical ratio. And if you look at this ratio of 1 to 1.618, it's found in the patterns on a butterfly. It's found on tiger's stripes. It's found in nature. And I didn't invent this. The Greeks and Romans knew about it. Da Vinci used it. Michelangelo, the painting The Last Supper is filled with golden proportions. Filled. And so I bring about that concept and talk to them about it, and then we talk about the fact that their face is changing, but I point out that after adolescence, the only thing that will never change till the day you die is the distance between your eyes. It stays constant. And it is a proportion of that to other parts of our face that we perceive as beauty. And then I have calipers that I use, and I point out some of the parts of their face, because everyone has some beautiful parts. Some people have parts that aren't as beautiful. And my job is to enhance the proportions in a way to make them not a different version of themselves, but the best version of themselves. And so we spend a lot of time talking about that.
Good.
Yeah.
So when they read your book, what are they going to find out? So this is part of it, is understanding the beauty. But then where do you go from there?
Yeah. So what are their concerns? I want to hear from them. You know, enough about me talking. Let's have you talk. And depending on what the concerns are, because some people have noticed they just want more enhancement of their beauty, and they're not that old. They just want a single thing.
Yes.
But often they'll have noticed maybe a few lines. You know, often it's lines that people start to notice.
Yeah.
And I explain to them the lines on our face form for different reasons. Some of them form because muscles move, and some of them form because we lose volume. And of the ones that form because muscles move, they're very, very predictable. The lines always form perpendicular to the muscle fibers. So this muscle that raises your forehead is called the frontalis muscle, and the lines always form this way because the fibers run this way. And so we talk about that, and then I talk about this concept, which is very important, of static versus dynamic lines. So I'll ask someone to raise their eyebrows, and generally, unless they have Botox in, you'll see a bunch of lines.
Yes.
And then I ask, and this is why they're looking in the mirror, and then I'll ask them to relax. And there's always a few lines left.
Yes.
And I say, and those are the ones you don't like. And they always say, yeah. They hate the ones that are there when they're not animating.
Right.
Right? We hate those lines.
Yeah.
So those are your static lines. The dynamic come because the muscles move, which is fine, but then they're there. And what I say is young kids animate like crazy. You know how much
Well,
kids...
they're all doing their selfies, and that's why they don't like what they see.
Yeah, but I mean like little kids.
Oh, little kids.
Think about this, right?
Okay.
Little kids animate their face like crazy.
Yes.
So why don't they wrinkle?
Yeah, because they're young.
Because their skin is elastic. Right. That's the point. Their skin is elastic.
Yes.
So we have 2 ways there's 3 things we can do about this, right? We could relax the muscles so they don't move as much.
Okay.
We can enhance their skin quality. Or we could learn to embrace and love those lines.
I don't want to do that.
I have no preconceived concept, and there have been times when I'll spend 40 minutes with someone and we don't do a single thing, and I'm okay with that.
Yeah.
I have no problem with that. Everyone has a different feeling, so I don't judge whether the lines are good or bad.
Right.
I know personally my feelings. We can talk about that.
Yeah.
But yeah, so we talk about the lines, and so I can go into this. So then when we talk about the lines, we talk about the lines and how they occur in different parts of our face, either because I see them beginning or I know they're going to come. And that brings me to my crystal ball.
Yeah. Let's
right?
talk about
You want to
that.
talk about
I
a
know
crystal
I've
ball?
heard you talk about it, and I
All
would
right.
love for our audience to know a little bit more. Yes.
All right. So I have a crystal ball. So I will generally ask someone how old they are.
Yeah.
And then I'll tell them it doesn't matter whether they're that age, 10 years older, 40, whatever age you are, when you sit in my chair, I can tell you in the next 5, 10, 15, and so on years what's going to happen to your face. At which point most people groan.
Yeah.
And I tell them that it ain't pretty,
Yeah.
honestly, but knowledge is power.
Yes.
And at least, and everyone has a different time and a budget. I totally get that. But at least armed with this knowledge, you can then make some informed choices because, as I said, we don't want to be the place you just come and get the latest special that month.
Of course.
It's something that you have a plan. And so unless they're, visibly shaken and leave the room at that point, I will then proceed, and then my staff gets really mad at me because I will point out some things that people will then say,
like, what are you talking about?
Oh, no. No, they see it, and then I know that there's people all over Richmond cursing me out, going, "God damn it! Now I see it, and I never saw it before." But my point is,
well, they saw it, but they probably just don't want to admit that it's there.
There's some places I'm brutal. I'm brutal, Dori. There's some places I go that I shouldn't probably go.
But it's good, At least they know the truth and they know what they can do about it.
I hope it's good. My staff sometimes gets on me a little bit. Another dejected Dr. Green patient. No, but for the most part, I think they appreciate it. I'm brutally honest.
Well, honesty is good.
I guess I can't help it. It's the only way I roll. Yeah.
Well, there's nothing wrong with that. So where do you go after you do your crystal ball assessment and tell them exactly what you think? Where do we go from there?
Well, we talk about the lines and from the muscles, and then we talk about the volume thing. I didn't even go there, but that's more bad news. Okay?
Yeah.
And I talk about the volume. But in general, where we go with that is what do you want to do?
The plan.
Yeah. What treatments are available, and what do you want to do? How can we make this work? What does it look like? What is the cost? What is the ongoing maintenance? What do we have to do to get you? What's going to make you happy when you look in the mirror? And it's not about, it ain't about their boyfriend, girlfriend, mother, boss. It's only about them. And I tell them, in my room, it's all about you. It's not about me. It's about you.
Yeah.
What's going to make you look in the mirror and walk with a bit more confidence? Because the book is not about Botox and fillers, and we don't sell Botox and fillers. We sell confidence.
Yes.
We give confidence, and it doesn't matter what treatment we do. At the end of the day, whether it's cool sculpting or whatever we do, it's all about confidence.
It's true, because at the end of the day, it's what you see in reflection in that mirror and what you think of yourself.
Yeah, it's how
what would you say when the younger generations comes to you, the millennials in particular, and here you are, like you said, you're not one. How do they take your assessment? Do they take it open-minded and say, yes, I want to do this? Or because it's coming from someone who's more mature? How is that interaction?
I like that mature word. Yeah, I'm going to use that. I like that. Thank you. Dori, I did not expect this because I have a fantastic staff who are all younger than me. I have a very talented staff, a talented young injector, and she's dynamite. And I just didn't expect that I would have as much of a millennial population as I do. So I think I'm doing something right. So generally, I think we vibe. I think they get it, and I think that unless
I think they respect it.
Yeah.
In a way that because you are more experienced, you're giving them that advice that they're looking for.
It probably is, and it's not preachy at all. It's just, it is what it is, right?
Yeah.
I mean, it is what it is.
And what I heard about you is you talk their language. You're like get with them and they can relate to you, because I think that's very important, because younger generation, sometimes they look at us like, what do you know? Right? But instead they're embracing that advice that you're giving them, and they're open-minded to it.
I do find that my vernacular is very different than my days as a urologist. And I love it. I feel like I'm just part of the crowd, and it's just I pick up the words. I am the parent of millennials, and I just pick up the words, and we seem to go well together.
Well, how did you get into expressing really your passion and getting so good at what you're doing right now as far as aesthetics. Like, how would someone know, like, who are you to be like the person to do all my treatments?
Look, I got to say that there's a great quote. I'm embarrassed to say I don't know who said it, but I can see so far because I stand on the shoulders of giants. So I've been very, very fortunate to have incredible teachers and professors. And I, as far as why would someone read the book, my papers, my cred, I went to Stanford for undergrad. I went to UCLA for med school. I was at Harvard for my residency. But I don't see that as why someone should come to me. I don't think that matters because there are people who go to different schools that are just as good or better. It is
well, to me, it matters.
Yeah, but I think it's more that I've just never been satisfied to not be my best. I'm really committed to training. Anyone who comes to our med spa, we train, and we train some more. We put it on our social. We're always training, always trying to get better. And so I think that's one thing. I think in terms of, if you're asking how should someone choose, I think in these days it's pretty simple to me. I think number one, you gotta, if you're choosing an injector, you just gotta look at their work. I mean, if they don't have good work, or if they can't do photography, they need to.
Yeah.
Like that's part of the game, right?
Exactly.
Like I wouldn't go to someone if I didn't know what they did. So you should be able to see what they did, and it should be. It also, the reason that's so important is because their style has to match yours. I can do certain things, but I don't always tell people I think it's the best proportion for their face. And I've certainly had people come in for one part of their face, and I will tell them, look, and respectfully, it's just not right here, and let's talk about why you see this. And those have been some of my most loyal, best patients where I refuse to make their lips any bigger. Because I tell them it's unnatural.
Because you're sincere. And you care.
And because they've lost the shape.
Right.
We can talk about lips, they're beautiful. So anyway, I think that, and you also have to look at reviews. I think reviews are important. We all look at reviews, right?
For sure.
Right? Don't you look at reviews?
All the time.
Yeah. So if the reviews are not good, I think that's a big thing. Or if there's not many of them, I think you have to look at their general appearance. You need to talk to friends, and then you need to go to the place and see, is it clean? Is it nice? Is it welcoming? And then the last thing is really, you just need to meet the person. And I implore everyone to trust their gut. If you don't click, if it doesn't work, then you guys, this is your face.
Yeah.
This is your face, right? And I've had
the most important thing to me.
Oh my God, I've had people sit in my chair going, well, I don't know what to do. Why don't you tell me? I go, this is your face. Think on it. I have plenty of time. Go away and think about it. This is your face. Yeah, so I think that's what people should do.
So do they come to you and say, why does my face look like you know what?
Yeah.
They probably use certain language that maybe I won't use, but you know what it is.
Yeah, it depends what stage of the journey they're on. But, this age range ranges from folks who are just, in their early 20s to people who are like maybe in their mid 30s. They've had some kids. They're really starting to sag. And so it is, I think, again, a journey I want to go on with them and assure them that there's, number one, there's things we can do, but number two, it doesn't have to be all done in one day.
That's true.
And that the other thing is it's not just one thing, it's many treatments, and what's the level of commitment, what's the budget, and let's work on something that can make it work for them.
I think that's most important, is understanding exactly what is it that they really want, and then giving it to them.
Sure.
So you talk about creating a plan or a customized program for someone based on what they need. What are you finding with this age group of people?
Sure.
What are some of the most popular things that you're finding you are doing for them?
Yeah. So if I had to break it into the category of, let's take it lines that form because the muscles move.
Okay.
We get the lines here, we get these 11s, and we get these crow's feet, and people know about that.
Yeah.
And in addition to trying to get the skin healthier, Botox is wonderful for that. But there are things that people don't know about. Some people, when they smile, they show a ton of gums, and they don't know that there's something that can be done very simple. So Botox can help that.
Yeah. Actually, I was shocked when I found this out, when I first heard about it, because I had a girlfriend of mine that had, you call it a gummy smile. Yeah. So you see all gums, and her teeth were like so tiny.
Yeah.
And she's such a beautiful girl, except for that one thing. They're just like, here they are. And she went and had it done, and I'm amazed. I had no idea
It's
that
so
this
simple.
can be so simple and so fixable. And now she's like a totally different person. Talking about confidence, oh my gosh, she has totally changed.
Do you know what makes me sad about that? I have folks who come in, they've been getting Botox for 15 years, and no one has ever told them that they could do that. And it's so simple.
Oh,
It's crazy. So, but it's a very, let me tell you something about gummy smiles. I've learned, I have scars on my back. It is a very personal issue. So the first thing I do about gummy smile is I'll show it either on picture or show in the mirror, and I'll ask a question. I used to talk right about the treatment.
right.
No.
Yeah.
I say, tell me, do you love that? And sometimes the person will say, oh my God, I love that's my personality.
No.
And then we go on to a different conversation.
Right.
Now, if they're either on the fence or they say, no, I hate that, I'll ask the next question. It's the same question. You ready for the question?
Yeah.
Have you ever practiced in the mirror, not smiling that much in case you were like going to an event, you're going to get pictured? If they say yes, it's a home run. I've got a fan for life.
Yes.
Some people practice in the mirror. And so some patients, but I have fixed early in my career, I've talked to people and I've done it and they don't like it. And so you have to be very, very careful that they don't see it as part of their personality.
They prefer to see the.
They think
really.
Yeah.
Wow.
Yes, and I'm okay with that. I don't have a judgment.
Yeah.
It's just that it's a
It's a preference, I
right.
guess.
And then I also point out that the corners of our mouth start to turn down a little
Yes.
bit.
Oh, tell me about it.
Yes. And so there's a muscle that you use, your detrusor anguli oris, and it's situated here. It helps you pull your lower teeth down. I'll have them pull their lower teeth down, and I'll explain that Botox in this area it's not going to be a wow result like here, but it's going to delay, it's going to reduce that getting worse because it's also a loss of volume. And then I'll introduce them to a muscle that they never thought about. And I always tell them, you either hate it now or you're going to hate it in 5 years. And I say, do you want to meet this muscle?
Who's that?
I'll tell you. You're going to pout your lower lip out? Just your lower lip. Yeah. So your chin just got all dimply and there's a crease in it. I told you I'm brutally honest. So this is the mentalis
Where's the
muscle.
mirror?
Yeah, this is the mentalis muscle. It's the only muscle on the face that inserts perpendicularly on the skin. So when it contracts, it puckers down, and it gives us what's called peau d'orange, the skin of an orange. I know you like French. So, but the problem is, it also gives
that's the dimple you're talking about.
Dimples, yes.
Because peau is the skin, orange is, of course, orange.
Yeah. I don't even know French, but I figured that one out. Yeah. So it gives us this dimply appearance and this crease here.
Yeah.
And the thing about the crease is that we have another computer in our brain, that's the age computer.
Okay.
So when you're looking across the hall, the room, and your brain needs to go, is that dude 25 or 55? Like, how old is he? Your brain is saying, well, he's got a line here, he's got a line there, he's got a line here, and your brain is doing that. You don't even know you're doing it.
Right, it's automatic.
Right. So many of us don't notice this crease, but it is aging us because it's a sign of age. And so I go area by area about what Botox can help. And then again, as I said, and there's one other, so a feminine face is more heart-shaped. It's wider at the top, lower at the bottom. As we age, we start to become more square. Women don't like that. Square is masculine. So one of the reasons, there's multiple reasons, but one is these masseter muscles, and this can happen in young women who are also who grind their teeth. They become very big, and it gives us a square appearance. So I use Botox a lot to atrophy those muscles, and it helps with teeth grinding, TMJ. Some people say it helps with their headaches. I don't promote it for that, but it's very simple, and so that's another use for Botox. So these are all the uses of Botox.
Yeah.
And,
would you say with that age group, that's probably the first to-go method or treatment that you do with them?
Yeah. Well, except the group that comes in. Some people just come in, they want bigger lips. So they want their under eyes, they have tear troughs. So not everyone has the lines, but some do. Most people, I believe in catching things early. We can talk about that, but yeah, I'm a big fan.
Do you find that most millennials that come to you already know about Botox? I mean, does everybody, or are there people that you really have to educate them on?
Yeah, I think they know because of social, they know some ideas, but there's a lot of myths out there. And until you yourself are in there, you don't want to look frozen, you don't want to look weird. So I love educating. That's a passion of mine. And so, most people know some, but certainly don't know to the extent.
Yeah.
Yeah.
Or maybe what they've heard about it is very minimal, and then you dive into it and explain it a little bit more.
Yeah, I mean,
For them.
just some people want more information, some less. I mean,
Mhm.
it's catered to the individual. I really think that's important.
Yeah. So the other thing I know that you do are threads. Are you finding that you're doing quite a bit of, whether it's PDO or other type of threads on the millennials?
Sure,
Or do you find you're doing it more on older people?
It's a good question about threads. Threads, what I love is having as many tools in my toolbox as possible, okay? And if you think about it, Botox is a relaxant, relaxes the muscles that cause lines, right?
Yeah.
Great, we got that.
Yes.
Fillers replace volume that we've lost. Where's my anti-gravity gun?
Yeah.
Right?
Yeah.
I don't have an anti-gravity gun.
Yeah.
Now I have an anti-gravity gun.
Yeah.
So fillers can lift. And so in the younger population, a lot of times, well, it depends on, again, in their range. So some folks in their mid-30s are already having some sagging, and they're perfect candidates because threads work best with healthy tissue.
Okay.
So if the tissue is too far gone, they're not going to have enough holding capacity.
I see.
So it's a wonderful thing for that. There's also people really, jawlines are big now, and having a snatched jawline. So even in a young woman, I can take a thread and snatch that jawline. They love that. Can also stimulate collagen production. So a lot of times when I do enhanced lips, at the end I'll put what's called smooth threads in the border to give it that pop, or even a barbed thread, a twisted thread. So there's brow lifts. There's a lot of things we can do with threads. So I love the flexibility because it's great for younger populations. It's great for an older population. It's a great tool to have. I love it.
That's great.
Yeah.
And are you seeing people are knowing a little bit more about threads now, whether they're, again, different age groups?
Yeah, slowly. I think threads they look so intimidating.
Like
on
into the
videos.
future.
Yeah, and for some
like,
reason they look really intimidating. And the truth is they can be done very comfortably and very effectively. So in the right hand, there's anything else is in the right hands that can be done.
And do you think, because that age group is so much into social media, are you finding that they're proud to get those kind of treatments where, like, maybe my age group or people older, it was like the secret, nobody must know that I'm doing all these things? Are you seeing them more open?
I freaking love this population.
Yeah.
I freaking love them. Early on, I had my first millennial in my seat. And, prior to that, it was like injecting. It was like, can I go out through the back door? There was anyone in the lobby. She's like videoing. She's phoning. She's FaceTiming while I'm doing her lips. I said, is that what you want to do? She goes, yeah, that's great with me. No, I think that I love their openness. I love the fact that they're out there. I love the fact that, because I think in general, people do a disservice if they don't tell people. First of all, people know anyway. Yeah. But I think they're refreshing in their honesty and their openness, and I love dialoguing back and forth. I think it's one of the joys I have. I mean, it's just there's all kinds of shit we learn together, you know, and I find out stuff in real time. Yeah. Like if someone has a problem, I want to know in real time. Just send me a text or DM me, let me know what's going on. I love it. Yeah. Yeah. That's fun.
Well, that's very unusual. That's why I like you, and your whole demeanor and openness about it is that you're just, okay, whatever, let me know. I'll help you. And you're so into it.
Get some good jokes out of it too. We find some good stuff to talk about. It's fun.
Yeah. Really fun. Well, I checked out your Instagram. It's filled with, actually, what I was surprised about, and when we were talking earlier, is they're actually sending you like before and after pictures, already doing it for you, so you guys can just use it.
Yeah, I love seeing it. I love seeing what they do, and then I'll take some of their pictures and do stuff. And
I don't think you see too many 50-year-olds doing that.
I would say it's a lot less. Yeah. It's a lot less. It's changing though, slowly. The demographic is changing,
it's becoming a little more.
I encourage that too. I try to encourage that openness, but it is.
That's nice. Yeah. Well, it's easy to be open with you. You have a nice way about you.
I think it sets you free.
It does.
It sets you free. Yeah.
Let's move down to the neck area with the Kybella.
Kybella.
So,
okay.
Let's talk about that. Do they even know what that is? Are you finding that they do? They come in asking for it?
Oh, it's very interesting about Kybella. Yeah. So your liver makes cholic acid, and your cholic acid goes through the intestines, and bacteria actually change it, metabolize it to deoxycholic acid. So deoxycholic acid is not actually made by the body, but it's made in your body because your bacteria do that for you.
Okay.
So Kybella is man-made synthesized deoxycholic acid. And what I love about deoxycholic acid, it freaking annihilates fat.
That's
I mean,
crazy.
how great is that?
Yeah, how great is that is right.
So it destroys the membrane of the fat cell, causing the fat cell to die. And so we use it as a tool, okay? So it's FDA approved for the submental area, double chin, right? Yeah. And when I first trained on it, I actually was not really being a good doctor. I was not being a good doctor because I would only treat people who had a really significant amount there.
Like a lot of fat.
Like a lot of fat.
Like a turkey, double neck,
right.
double chin, double neck.
Yeah. Now, I have this, as a matter of fact, I just saw her recently for follow-up for her Botox, but she is a great person. She works with autistic kids. She's lovely, and she's tiny, but she had this little tiny thing. It bothered her. When I first started doing this, the way I was trained, I would have said, no, it's too small. You know what? I did 2 vials on her. Now this tiny thing went to 0.
Wow.
And she's thrilled. She's thrilled.
Yeah.
And it took 2 vials, and you get it causes an inflammatory reaction. I tell people you're going to look like a bullfrog for a week or 2. And now with the mask, you can do things. Yeah. But I love Kybella. We use it off-label too. People develop what's called bra fat. Use it off-label but we use off-label all the time. I mean, even Botox is off-label in certain areas. So I love Kybella in the appropriate patient, and my patient range has completely expanded. Now, having said that, we also have cool sculpting, which we have in our spa, and that's great for this area as well. Some people do not want to have that bullfrog. Some people have a different approach, and if they're an appropriate candidate, we have that. So I love having multiple tools.
So do you do, because once you get rid of that, don't you have loose skin? Are we doing like tightening after, or what is the procedure after?
Yeah, that's why it's so important to go to someone who's going to fully assess you, because I will turn away people for Kybella if they have excess skin. And in general, if I had to say, you start getting into your 50s and 60s, if your skin laxity is such that it's going to be loose skin, I don't do Kybella. Okay. And I work closely with a bunch of plastic surgeons, and I will just say, this is not for you. You need to go have plastic surgery. Okay. Same thing with I can do a liquid facelift. I can do full face rejuvenation. But at some point, I tell people, this is not the best use of your funds. You need to do this. Yeah. Yeah. Yeah,
because, and those are the older folks, of course, because then you're going to need more than what you can do with non-invasive treatments.
In general, but I see patients even with some structural mandibular abnormalities, even if they're younger, and I'll say, you know what? I could mask a little of this, but you really should visit an oral surgeon, because maybe offsetting your jaw a little bit, even though it's a bigger surgery, is we're talking you got another 40, 50 years, and if I give you something temporary, you have to repeat. So it's just whatever's best for the patient.
Yeah, very nice. Yeah. So let's shift a little bit into lasers. I know a lot of people, especially for the face, let's start with laser resurfacing or different levels of lasers for the face. What are some of your favorite treatments, and what are you seeing demand for in your community or from people that are coming to you?
Yeah. Well, maybe we should, I don't, if you want to really scare the audience, we show them what I looked like 10 days ago.
No.
Remember I showed you?
The reason I'm asking you that is actually with lasers, because I see what you...
10 days ago, I looked like an alien. Pumpkin head with stuff dripping off my face.
Maybe we can include that in your book.
Yeah.
Or they can see
if we don't want to sell any.
Yeah.
Yeah. So look, I love laser. I love using light-based energy. And the reason I'm so careful about saying that is because there's a modality called IPL. We call it BBL. And so technically a laser is one single monochromatic wavelength of light. But there's another technology that uses multiple wavelengths. So it's technically not a laser. People call it a laser. And both of those are great for skin, okay? Yeah. So when it comes to our skin, I could talk a lot about skin, but skin is so important because it's the wrapper in which the world sees you.
That's right.
Right? So I could take, and I talk to my patients about this all the time, I can take the finest silk in China, and I can take burlap, and I can bring it to a dressmaker. Yeah. And he or she can make me the same exact pattern. Which one's going to look better? Oh. Right? So
the silk.
So yeah. So the skin is so vital. Yeah. So we can use light-based technology, lasers, IPL, to get rid of brown spots, red spots, uneven complexion. Because what people don't realize is there's two things. You know, when the Renaissance painters wanted to depict youth, they did two things: evenness of complexion and reflectivity of light. So as we age, we start to get browns, we get reds, we lose that evenness of complexion, and our skin becomes very, very dull, right? So for the complexion, we can use light-based therapy, and this is like science fiction to me. The first time I had a BBL, literally the brown spots come up to the surface and they fall off. I'm like,
Crazy.
get out of here. Like, no
Magic.
shit, this is coming off my face. It's crazy.
Yeah.
And so you literally see this. And then you know, you can, blood vessels, like those little annoying veins you get in the corner of your nose, you can zap those. So it's very, very
Rosacea.
cool. Rosacea, you never cured a rosacea, but you can tone it down. Yep, you can tone it down. And then for the surface of the skin, a lot of what we do in med spas and everything is to exfoliate, okay? Because the outer layer of your cell, the epidermis is dead. The outer layer, stratum corneum, is dead. And when we're young, our cells are rapidly dividing. Guess what? That layer is thin. Not so much when we get older, right? And if you think of a mirror that's clean is very shiny. What happens? You put dust on it, not so shiny. You put a little dirt on it, really not shiny. That's why we become dull as we age. So we can use lasers to exfoliate that outer layer of skin. And depending on the depth that someone will let me go, we can get some crazy results. I think I showed you some crazy results. Like a deep resurfacing is insane. Yeah.
So painful.
Uncomfortable.
Uncomfortable.
Having gone through it, I would say having gone the recovery of it, it's uncomfortable. Like I think of pain as like a sharp thing, but it's just uncomfortable to be so swollen. But it's totally worth it. It's totally worth it. Oh my gosh, yeah.
You're like a young man Christmas morning.
Oh my God, there's
like
so many
excited.
toys we have.
Let me laser you.
I tell people, we have so many toys to play with. It's crazy.
Yeah,
it's like playing.
So many options, right?
So many options.
Yeah. What are you seeing the difference of people? Like, who are the people that are saying, okay, let's go all the way? Or the people that say, okay, let's just do a light peel first.
Yeah.
What are you seeing there?
I think most people are cautious. You know, people are very, they dip their toes in the water, and I think that's really important. I never encourage people to do too much at one time. And we get some people who've been doing stuff already. So and I think with this population, with the millennial population, I think it's really important to educate about skin care and what they can do for their skin. I spend a lot of time on that. Yeah.
And I think with that population too, is they're still going through some of the young adult acne too, where they have some issues. So what are some of the treatments that you're offering for that? Yeah,
well, when we talk about skin, acne, and other things, I'll talk to them about, you know, a lot of them sort of, I think it's important to teach people why their skin ages, what's happening to their skin, why does it look like crap sometimes. So the first three reasons, can I take a phrase from real estate?
Okay, go ahead.
Sun, sun, and sun. Okay, location, location. So the sun is accountable for 90% of the stuff you don't like on your skin. And sun is a bear to skin. Sun is terrible. But so we talk about sun, but you know, most people know about SPF and they know about UVA and UVB. Did you know that UVA and UVB make up only 7% of the rays?
Really?
Yes. So 55% of the rays that are coming in from the sun are infrared, and of that there's a subtype called infrared A that is extremely aging, and most sunscreens do not protect against that. And then there's another one called HEV, high energy visible light. Now when I talk about this, I usually pick up my cell phone. And when I talk about HEV, I say, do you ever have one of these by your face?
Oh, wow.
So you're getting HEV from your cell phone, from your computer monitor, from fluorescent lights every day, 365. So I really try to impress how important it is to have sunscreen. And then a lot of them will say, I said, do you wear sunscreen? They go, yeah. I say, tell me about it. Well, it's in my moisturizer. In which case I pull out my tissue and I start crying. I start crying. I start crying and they feel bad. I said, no, you can't do that. It's not, because
it's not enough.
Even 83% of the dedicated sunscreens on the market don't cover against infrared or HEV, right? Your moisturizer ain't going to cut it. So it is like gospel. 365, put on sunscreen in the morning, a dedicated sunscreen. Make sure you do your research, because it does not make sense to pay me lots of money to do your Botox and do your fillers and do these lasers if this simple thing that could cost you very little, you're not doing, right? Right? I really I really
Yeah.
get on my soap.
I think they have to develop healthy habits at home, like rituals and habits to get into their morning routine. What do you do? Your evening routine, what do you do?
Well,
And those are the things that I think people miss out on.
yeah, I spend a lot of time on basically just skincare. So
Mm-hmm.
skincare, like we'll say, I'll ask them what they're doing, and as you get towards the older end of the millennial population, they usually have a lot of, like, I'll use different products,
Mm-hmm.
and then I'll listen for a while, and then I'll say, did you know that the average American woman has $1,150 worth of products in her bathroom because she started with this and then went to that, and then someone told her about it, and they usually give me a nod. So I said, no one's giving you a plan. Let's come up with a plan, because there are some basics that everyone needs for their skincare, and we can go as in depth or not as in depth as you want, but it's really important.
And the other thing I still see, I'm fortunate enough, I live on a beach, and I see young people or even old people in my building. They're still sunbathing, they're still oiling up, and their skin, you can see it's becoming like leather. It just does not look attractive at all, and it shocks me there are people that are still doing that instead of sitting under an umbrella.
Or if you can go to my Instagram, you'll see a picture of me I look like the freaking Invisible Man. I've got a long white shirt. I've got a white thing on my neck. I've got a white thing.
You have a hat with that flag in the back.
And I've got sunglasses. You can't see anything. But you know what? That morning, because I am a beach fanatic. I love the ocean.
Yeah.
I walked my dogs at 6. I was setting up the tent. I was on the beach all day long. And I had a great time. So I look like a freak. I'm a freak.
That's okay. No, but at least you're protecting yourself.
I had a great time.
That's the most important, especially since you are light skinned.
Are you saying I don't have much hair? What are you saying?
You
Is that what
have
you're looking
lots
at?
of hair.
I have a lot of real estate. I get it. Yeah.
You have a lot of sunscreen to use
I have
all over.
a lot of skin real estate, Dori. I do.
Let's shift a little bit into microneedling and how that's becoming like so popular with everyone, not just millennials.
Yeah.
Don't you just love that treatment?
Yeah. I'll tell you, microneedling and a bunch of other treatments we do is you paying me to hurt you.
Yeah.
That's what it is. People pay us to hurt them.
Yes.
So microneedling, radio frequencies, the lasers, we're causing
You're creating
trauma.
injury, yeah.
Yes, it's collagen-induced, it's CIT, collagen-induced therapy. So microneedling is taking thousands of little needles, puncturing the skin, and the way your body responds to trauma is to bring in the troops, bring in the cytokines, bring in the growth factors, call the fibroblasts.
Yeah.
So
Call the fire department.
Yeah. So we do it with and without PRP. And we have a wonderful, wonderful esthetician who's very experienced. And people leave our microneedling and they look like a cherry tomato. And it's great because that's what you want, right? And then, we do it with platelet-rich plasma because we have this very sophisticated double centrifuge system, but your own growth factors are going to be the best thing.
Yeah.
There are some other ones you can use, but if you can use your own growth factors and put them in all those open channels, it's phenomenal.
Yeah.
So it's a wonderful therapy for skin texture and rebuilding collagen.
So describe that appearance once somebody has microneedling. What can they expect for results?
Oh, for results, yeah. So it unless you're 22, it's not one and done. Okay, so really you're going to look at a series of about 4, spaced about a month apart, taking good care of your skin at the same time.
Yeah.
And you can see some of the fine lines get better. You can see the reduction in the appearance of pore size. It's not the actual pores, but the appearance.
Shrinking them.
Yep. And your skin just has a much healthier tone to it. And it's really part of not a standalone program, but it's part of everything you should be doing.
Yeah.
Yeah, it's a wonderful way. Yeah.
I think I've seen some of my friends get it. I have not experienced microneedling myself, but they have this nice glow about them.
Yeah.
Their skin is just glowing.
And that's the thing about the lasers we have. So microneedling is on the surface, maybe 3, certain depth. And then we have the world's first hybrid laser that's a tunable hybrid laser called the Halo. And we can deliver, so if one were to do this therapy, you can deliver, so you're delivering injury on the surface.
Yeah.
We can deliver injury below the surface. And so then you're working on both aspects.
Wow.
Because the skin's a very complex organ. And if you can get both of those things going, you're rock and roll.
You're in.
Yeah.
Yeah.
Yeah, it's cool.
So what time frame are we talking?
Oh, let's do it now.
If you did both. Yeah.
what time frame.
What are they doing? Are they doing the halo first and then the microneedling, or are you combining them at once?
Yeah, I mean, if people really come to me and say, hey, I want to really get my skin looking great this winter, we'll do microneedling once a month, the BBL, the IPL therapy once a month, and we'll switch it every 2 weeks. So that's a great way to go. But I think it's again, and for the younger folks who, believe it or not, we put them in this Vizia machine, and we can see they have tons of sun damage they don't even know about.
Yeah. Well, the skin analysis is so important, and when they see that, it makes such a difference that they're looking for help me, right?
Yep. Yeah.
What about radio frequency?
Again, it's a controlled trauma, right? So we use radio frequency to heat up the tissues and shrink the tissues for an immediate effect, but more importantly, cause fibroblasts to come in and lay down collagen.
Okay. Yeah. From the treatments that we've discussed so far, what would you say is probably the most popular with millennials in particular?
Yeah. Botox is number one. Absolutely. And I think for good reason is because the folks who come in, they get the fact that they don't want to wait to get further down the line. And indeed, if you do it early, you can prevent those from ever occurring. Like, how wonderful would that be, right?
Yeah, that would be great.
They never showed up. And it doesn't take a whole lot because when you're young and your skin is still relatively elastic, the doses you need are not as much. We can still keep them looking natural. And honestly, I can't think I've ever had, with the exception of the gummy smile, I've never had someone be unhappy. And the thing about Botox also is so some people are worried about looking unnatural, frozen, and everything. And hopefully they trust me. But I tell them, it's 3 months. It's going to wear off in 3 months.
Exactly.
If you really hate it,
it's not permanent.
Well, it's 3 months,
Yeah.
And then after the Botox, it's definitely filler after that.
Yeah. Okay, great. So we touched a little bit on laser resurfacing, but is peel another option for people that don't want to go the laser way? Different levels of peels?
Absolutely. Love peels. Peels are a fantastic treatment, especially some people suffer from melasma, which is this sort of brown pigment, but it happens typically either in a mask-like distribution, over the lip. Sometimes it's related to birth control, and light-based therapy can actually make that worse. So we tend to use peels for that, and we have peels for acne. We have a wonderful peel based in salicylic acid that is great and complexion clearing. Again, it's that exfoliation. So peels are a wonderful complement, and they're very, very popular.
Yeah, and they're easy to do, really.
Yeah,
easy to experience as well.
I experienced one about 2 months ago, and I was like, what is happening? My face is falling off.
Oh, no.
Yeah, it was fun. It's up there on the Instagram.
So, Dr. Green, when you're working with people, do they have a fear of not looking natural, or does that come up?
All
the time.
Yeah. But I know that as an injector, if I make them look weird, I'll be feared, right? So I ain't going to go there. I'm not going there. So, yeah, I really do. I mean, I understand that. It's a big commitment, more so with fillers than Botox, because I do understand Botox will wear off, although there's a fear. But I think that showing them my concept, again, this is how getting to know your injector, my concept of how I think of beauty, show them their face, and show them how that with a little cheek filler, I'm going to bring that closer to the thigh proportion, and here's what I think it'll do. I think that makes it feel a little safer. And so it's really important to me that people look like the best version of themselves, not a different version, not trying to change anyone's appearance. And when I have folks who are, even if they're in their mid-30s, I'll say, bring me a picture in your 20s. I want to see. I want to see what your lips look like, because we do lose volume in our lips. And it's important to have that discussion and that level of trust. Yeah,
I think so. It's very important. And again, you don't want to look like a freak. I think that's probably everybody's biggest fear, because there are some people that take it to an extreme. And frankly, we hear from people on Meet the Expert is that they don't want that look. So that keeps them away almost from coming to a med spa. And that's not a good thing. We don't want to scare people away. We want people to come and experience and know that you choose, right? You choose how far you want to go with your treatment. So you look natural.
Yeah. Absolutely.
So natural is very doable. It's just a matter of, again, who you choose and the plan that you come up with together.
Yeah. I mean, if you believe that the way you looked at 22 was natural. You know, you can't promise to be exact 22, but it's moving towards where you were when you had a little more volume and less lines.
Yes.
Yeah.
Exactly. So, are there some risk that people ask you about, or talking about that fear?
Sure.
Some things that they need to know about that we can help them.
Yeah. Look, after 26 years of doing surgery, I'm big on talking about risks, you know, because it's very important that people are informed, right? Because bad things can happen.
Yes.
Bad things can happen. When it comes to Botox, Botox is a purified protein, okay? You cannot get botulism from Botox. You can't. Botox is a trade name. It's like Kleenex means tissue.
Yeah.
There are a couple different brands. But the important concept is that Botox interrupts the signal from the nerve ending to the muscle. So if you have no Wi-Fi on your phone, right?
You have no signal.
Wait, no Wi-Fi.
Okay.
And the cell tower gets knocked down, so the cell tower is out.
Okay.
Then you can't surf the net.
Right.
Got to put it in terms, right?
Yeah.
That's what Botox does.
Okay.
Botox cuts down the cell tower.
Yeah.
And so that's what it does. And it does that.
It's a good analogy.
Yeah, and it does it pretty rapidly, and it lasts for about 3 months. So it's not actually working for. It's not actually doing that for 3 months.
Right.
It does some real. I get into my science geek. I love talking about how Botox works in the presynaptic membrane, but I won't. We'll lose everybody. But I love talking about it. But anyway, so think of it just as the signal gets cut, and then for the next 3 to 4 months, your muscle is chilling. Yeah, and so, but wait, so the risks. So the risks.
Yes.
So the real risks of Botox is that you could look weird, not like the way you look. The brow is going to drop. Women do not want their brow dropped. But you can go to the best injector in the universe. By definition, if you do anything in the frontalis muscle, you're going to drop a little bit, but there are ways to mitigate that. Right. You could get an eyelid droop. That shouldn't happen, but it could, but you shouldn't really happen. That's going to be not so great for 3 months.
Yeah, no, that's not good.
Right. You could get a weird crooked smile. So those are probably the worst things with Botox. Filler, on the other hand, is number one, you could look weird if you go to the wrong place. Number two, it could be lumpy and bumpy. I only use fillers that are dissolvable, so that's much less of a problem. But I live in fear every day as an injector. I live in absolute terror of one thing.
What?
A vascular occlusion. So when we put fillers in the face, you know, there's always the possibility that the filler could go into a blood vessel at the end organ and either necrose skin or blind somebody. That's the reality. Yeah. I don't pull any punches. That's a reality. So I live in fear of that every day. I train some more because I don't ever want to have that.
Yes.
Thank God I've never have.
Yeah.
I'm ready if it does. I know how to handle it. But that is the biggest risk, and people deserve to know about that. And it's very unusual, and so you need to know who is putting. Because let me tell you,
who's injecting you? Yeah.
You know how not to choose a med spa?
How?
Groupon.
Oh yes.
You know, tell you something. Here's a piece of advice. Yeah. You're not paying for the Botox, and you're not paying for the filler.
No, I'm paying for you.
You're paying for the hands.
For the hands.
Yeah, you're not paying for that other stuff.
Yeah, it's true.
So when it comes to filler, you just gotta be really careful.
And frankly, that's why I'm doing this show, is because I want people to know who the true experts are, and they can trust in the fact that you are great at what you do and you are truly an expert.
I'm very committed to what I do. I love it, and it's a lot of fun. It's a privilege to be able to have someone, this blows me away.
Trust you enough.
Trust me with their
your face, yes.
I mean, that's crazy. So I don't take that for granted.
Yeah, that's a big compliment to anyone that
it's huge.
Truly.
I feel very blessed.
Okay. What do you think about like before and after pictures, and are you finding that more people are willing to do, because that's like in today's society, we all look at reviews, we all look at before and after pictures, what other people have said. So are you finding there are people more open to doing before and after pictures?
I get yelled at least twice a day.
Yeah.
Because I take too many pictures.
Oh.
Patients come in, I've got this blinding lights, and I insist we do it the same way every time, because you can do some really funny stuff with pictures. So we have the same setup.
Great.
I have everything the same, because I tell them, it's when you come in 3 months, I don't want to do some different lighting.
Yes.
So I think before and afters, forget about posting, forget about social media. I want to show you that we're not smoke and mirrors. Like, I want to show you in your medical chart.
Right.
If you let me post, that's great. So I think they're really important. I think that anyone who goes to an injector and has not seen their work, like, I don't get it. I just don't get it. Like, you should do your
You're
homework.
going blind. Yeah.
You do your homework. It's your face.
Yeah.
And maybe you don't like their style. Maybe they do really crazy cheekbones. I don't know. But at this day and age, there's no excuse not to know who you're going to.
What are some of the expectations, like when they make the appointment, once they come to the appointment, after the appointments? Are there some things that they should be doing pre and post appointment?
Sure. Bruising is not the end of the world, but we always like to minimize bruising. So for anyone who's coming for Botox or fillers, it's best to, if you're on aspirin or Motrin, stop that for a week. If you're on any kind of medical blood thinner, talk to us first. I don't want you to go off a medicine that you're important.
Right.
And it's not that you have to, because if you bruise, you bruise. It's just that, we want to have everything going in our favor. There are studies in the literature. There are studies both showing and not showing that arnica montana can decrease bruising. But there's a preponderance of literature now that shows it does. So I recommend taking arnica montana 3 days before and continuing it a week after.
Okay.
There's some literature about rhinoplasties in arnica and faceless in arnica. So I think it's very reasonable. I think that alcohol also does increase your clotting time. So not drinking for 24 hours, no alcohol for 24 hours before and 24 hours after. Exercise does raise your heart rate, your blood pressure. It's vasodilation. So 24 hours after Botox, don't exercise. And for fillers, depending on the area, certainly at least 24 to 48 hours. Threads, possibly 3 days to a week.
Okay.
It just depends on the area.
Okay.
And then for lips, no working out, no making out for a day.
Bummer.
Yeah. But
gotta let them heal. Let those lips heal. So as a last question, what are some of your golden nuggets on how somebody can handle the entire aging process? Final tips.
Okay. Well, we're all aging.
Yes.
And if you want to try and slow down the process, there's a couple of things. First of all, your diet plays a role. So eat things that don't come in packages.
Yes.
Things that grow on the earth. Things that are rich in antioxidants. I happen to be a huge fan of supplements as well.
Okay.
That's a whole other topic of time, but a big fan of supplements.
Maybe we'll do another interview on that one. Love to have you back.
Yeah. Next thing is sleep. Your body is regenerating during sleep.
What's an ideal amount of sleep that you recommend?
Oh, I thought you said what I get, because that's pitiful.
Yeah, you're not practicing what you're preaching.
Yeah,
I
know
no.
I think 8 hours a day.
8 hours you must, yeah. I don't get 8 hours either.
Yeah, you really, if you really think about it, 8 hours would be ideal. It does mean that you're sleeping for 1/3 of your life, but you know what? You're more productive, and it is good. Think about it, right? When you don't get enough sleep, do you get bags under your eyes? There's a reason that happens. So really having good sleep practices, shut off the electronics before you go to bed, okay? Yeah. So diet, sleep, and then pollution, to the extent you can control. Pollution really eats away at our skin. So at least if you get an in-home air cleaner, the less pollution you're exposed to, the better. And then I hate to tell you, but stress really plays a role.
I'm sure.
Stress.
That's probably the biggest.
Stress causes, stress, and if you smoke. So if you smoke, stop smoking. It constricts blood vessels, lets nutrients. There's other chemicals. So smoking, don't smoke tobacco. But stress is really a big deal. We have all these inflammatory mediators that get provoked when we have stress. Even cortisol, believe it or not, actually can break down your collagen. So stress has pro-inflammatory proteins, and you're going to have less healing. So there's, again, my science geek could go on and on about this, but chill, baby, just chill. Yeah.
Chill, guys, chill. That's the message from today. You have to chill.
Just chill.
Just chill. Oh my goodness, this was so great. I have learned so much today, and I'm sure our audience has as well. Why don't we tell them where they can learn more about Dr. Green? Maybe give them a website, your Instagram. That's amazing, that everybody should go and check out.
So my own personal Insta is at Dr. Lonny Green, which is just DrLonnyGreen, at Dr. Lonny Green. But my Rejuvenate's Insta is at Rejuvenate_MD. And, we've got a lot of stuff there. We love to engage with people. Love when people engage with us. So we have a website, rejuvenate-md.com. My amazing, amazing staff who are way, way better than me and better looking.
I don't know
I
about that.
encourage everyone to go to rejuvenate-md.com because I've got the most unbelievable staff in the world. Very, very talented, very, very good at what they do, and really passionate about helping people. So,
that's great.
Yeah, that's the way to reach us.
Because at the end of the day, it's not just one person. It is truly the entire team that can help you.
Yeah, and my email is lgreen@rejuvenate-md.com. So that's my email.
That's wonderful.
You can direct message me on Instagram, send a smoke signal, whatever way. I'm happy to get messages.
Yeah, wonderful. Well, it's been truly a pleasure having you. We definitely need to do the supplement one because that is a topic that I have not had anyone on the show, and I would love to have you discuss that.
I could talk
because that is like so confusing. You
Yeah.
go into many of these supplement stores, it's like, how do you know what to purchase?
Yeah, I actually recently got a bunch of supplements for my staff because if you look at there's actually very good literature from COVID about levels of melatonin, levels of zinc, levels, so
that you need.
Vitamin D. Well, that the patients who came in with higher levels absolutely did far better. So I've got all of them on that.
Interesting.
All of them are now on that.
Yeah, very good to know. Yes, we should definitely plan it then.
Love to do it.
Great. Well, thank you so much for joining us on Meet the Experts. Like this show, make sure you give us a thumbs up, make sure you subscribe and ring the bell so next time we put out a show, you'll be notified. Thank you so much for being with us. Thank you so much for being here with us,
Thank
Dr.
you for
Green.
having me.
And stay safe and live healthy.